We start tonight's fine print from India. The southern Indian state of Kerala has a battle in hand, the Nipah virus. It is wreaking havoc as we speak. This is the fourth outbreak of the disease in Kerala over the last 5 years, and still people have more questions than answers. In the next 2 minutes, we are going to tell you everything that you need to know about this virus. First, some updates from the ground. The Kerala government has confirmed 5 cases of Nipah so far, and 2 people have died because of the virus. Officials have announced containment zones for the suspected patients. Contact testing is being carried out and close to 700 people are being monitored, out of which 77 fall in the high-risk category. Now about this virus, Nipah is a zoonotic virus, which means that animals transmit the virus from people. Experts say that fruit bats are believed to be the virus's source. Nipah usually infects dogs, cats, pigs, horses, sheep, and then is transferred to humans. The incubation period is of great concern. The symptoms can start showing within 4 to 44 days of getting infected. Next question. What are the symptoms? Usually it begins with a fever, a headache, some cough, a sore throat, dullness, disorientation, and things progress fast with this virus. And this is when things get scarier. A patient could possibly land in a coma within a day or 2. Let's now talk about the fatality rate. Nipah has a fatality rate of anywhere between 40 and 75%. During the 2019 outbreak, more than 90% of Kerala's Nipah patients died. That's a fatality rate of 90+%. What is even more concerning is that there is no cure so far for this virus. Now let me tell you about some precautions that you can take. Since fruit bats are at the start of this infection chain, let's start with the source. You see, bats are messy eaters. At night, they eat fruit and berries from the trees, and often they drop partly eaten fruits onto the ground. So if the bat is infected with this virus, the bat's saliva infects the fruit too. So virologists suggest 4 precautions. 1. Avoid coming in contact with animals like fruit bats and pigs. 2. Avoid half-eaten or fallen fruits. 3. Stay away from infected patients. And 4. Practice good hand hygiene by frequently washing hands with soap and water. Now, to discuss the ongoing situation with respect to the Nipah virus, joining me now is Dr. Rajiv Jayadevan, a member of the Public Health Advisory Panel of the Kerala State Indian Medical Association. He joins us from Kochi. Doctor, thanks for joining us. What can you tell us about the Nipah virus outbreak in Kerala as of now? We know some areas have imposed restrictions.
You've given a good summary of the virus at the outset, so our viewers are tuned in. So let me fill you in what's happening on the ground. Kerala has had the 4th outbreak of Nipah virus, and as we saw in the visuals and through your narrative, it's a virus that lives peacefully in bats, but not so much in humans. The moment it gets a chance to infect a human being, it takes a violent turn and produces lung disease, leading to breathing trouble, and it can go on to infect other parts of the body, including the brain, wherein the individual may get confused, the speech may get affected, the ability to walk may get compromised, and so on. Eventually, the individual will slip into a coma. And that is not just a case of Nipah virus. Any virus that can infect the brain, resulting in encephalitis, can do that. For instance, Japanese encephalitis. So Nipah virus does its act in 2 phases. 1, it jumps to an abnormal host, that's man. And second, the infected human being transmits it to other people. Now, the second phase is not so effective in the sense, from the viewpoint of the virus, the chain of transmission is not as strong or nearly as strong as it was with, for example, the case of COVID or even with measles. In other words, the ability of the human being to transmit this virus to remote parts of the country, or to put it in pandemic terms, whether it has pandemic potential, no, definitely not. All Nipah outbreaks are self-limiting and localized. They do not spread far and wide, but that should not stop us from tracking these contacts down and stopping them from potentially infecting other people.
Doctor,
as
what
we
you
saw,
said, I must say that's very reassuring, because I think whatever you've said so far when it came to the symptoms, I got a sense of deja vu, because everything you mentioned was very similar to the coronavirus. We've seen the kind of havoc that virus can wreak, but you're saying that the Nipah virus does not have pandemic potential. Am I correct?
It does not.
All right. How contagious is this virus even so? The symptoms are similar to coronavirus, as we've discussed.
Yes. Well, how contagious is it? Stay away from bats. Do not handle animals, if you're not a professional, that is, and not the least without any protective equipment. And please, a bit of advice, additional advice is do not go after bats. There are some people who think that let's go out and kill a few bats. No. Please stay away from these animals. They're peace-loving animals. They do also contain a whole bunch of viruses you do not want to get involved with. So stay away from them. And if you find a dead bat, leave it alone.
Right.
So those are some precautions. Back to the second part of the question is, how efficient is transmission from person to person? That depends on the presentation. For instance, if you find an individual who's so short of breath and is coughing and there's plenty of droplets around that person or fluids around that person of any form, and if the healthcare worker or the caregiver comes into contact with these fluids of any sort, be it urine, blood, sweat, saliva, or respiratory secretions, yes, they could get infected. And we saw in the present outbreak that there's a healthcare worker who got infected. Thankfully, his symptoms are not very severe as of now, but he tested positive for Nipah virus. So the healthcare workers are at risk, be it a nurse, a technician, a doctor, whoever interviews a patient or a bystander. So it tends to affect people who are closely involved with the patient, rather than like COVID that can spread from, for instance, the R0 of COVID, which means the ability of one person to infect other people is 2 to 3 on average, which means that if I get COVID, I can, on average, spread to at least 3 people. And those 3 people will give it to 9 people, and so on. For Nipah, the numbers below 1, which basic math says that eventually it will die down. I can infect 0.4 people, and that person can infect 0.4 people, and eventually it dies down. That's how these outbreaks become self-limited.
Right, Doctor. Thank you so much for all your insights. Thanks for breaking it down for us. The reassuring words that this does not have pandemic potential. Thanks for coming on WION. WION World is now available in your country. Download the app now and get all the news updates on the move.